The facts you need are in the book, and it's totally free. Call 1-800-552-8894 or go to humanafreebook.com.
In high definition, this is KCAL 9 News at 4.
Welcome back. I'm Sylvia Lopez. And I'm Lena Wynn. Now to closing LA's multi-million-dollar budget gap. For a start, Mayor Antonio Villaraigosa wants to eliminate 3 departments but consolidate their functions under new management. KCAL 9's Mark Coogan live in our newsroom to tell us what this will mean for the average resident. Mark.
Lena, the latest to go is the department that oversees LA's system of neighborhood councils. According to the mayor's office, the councils will continue promoting neighborhood improvements, but the overhead will vanish. Trying to eliminate LA's $212 million budget deficit, Mayor Villaraigosa today axed another city department. He ordered that the Department of Neighborhood Empowerment, which oversees the city's 90 neighborhood councils, disappear inside a larger department, eliminating 27 jobs and saving about $3 million a year.
We're not cutting neighborhood councils. We're cutting a downtown bureaucracy that has spent too much time over-regulating our neighborhood councils, and that was never the purpose of this movement in the first place.
Over the past 4 days, the mayor has ordered 3 city departments shut down: Human Services, Environmental Affairs, and now Neighborhood Empowerment, eliminating 83 jobs, saving around $6 million. The city council will have to say yes or no.
And if we don't make any cutbacks anywhere, we're just going to continue down that path where we self-destruct.
In the big picture, the city council last week approved the elimination of 4,000 city jobs to help balance the budget. Mayor Villaraigosa called on city unions to take pay cuts to minimize layoffs. But the unions argue that layoffs will trigger even bigger city expenditures.
If they lay us off, they're going to have to pay back all of the cost of living that they owed us back from July 1st, 2009. That's 22,000 people that you're going to have to pay back.
Also, the city will owe laid-off workers unemployment compensation. But the mayor's office says long-term, layoffs will save money.
Do we want to do it? No. Is it the best option? Of course not. But absent some other concessions from our friends in labor, we'll have no other choice.
While this was going on, the mayor's office today began meeting with department heads to formulate next year's budget that already faces an estimated $485 million deficit. An aide to the mayor said that pared-down budget will reflect a city government that will look nothing like it does today. Live in the newsroom, I'm Mark Coogan, KCAL 9 News. Sylvia, back to you.
Okay, thanks, Mark. President Obama is hoping to break the health care stalemate. He has a new proposal combining ideas from both the House and Senate reform bills. After a year of bitter partisanship in Congress, President Obama is attempting to take control of the health care debate. Today, the White House unveiled its 10-year, $1 trillion plan on its website.
I do think it's likely that we'll get health care reform done this year, because I think that the price of failure for everybody involved is far greater than anything else.
The plan requires most Americans to have health insurance and offers federal help for those who can't afford it. It bans insurance companies from denying coverage based on pre-existing medical conditions. It also creates a new insurance marketplace to help people and small businesses purchase their own plans. The proposal also gives the federal government new power over insurance companies, including the right to block rate increases. The administration says this plan would give coverage to more than 31 million currently uninsured Americans without adding to the federal deficit. Republicans aren't convinced.
When will Washington get it? Americans are making do with less. Shouldn't the federal government they pay for at least do the same?
The White House plan includes a handful of Republican ideas designed to eliminate waste, fraud, and abuse. The president hopes that will encourage the GOP to compromise on Thursday when Democrats and Republicans meet for a health care summit. But that's not likely. Top Republicans say they want to scrap all the current proposals and start from scratch on health care reform. Lena. It's a leading cause of death for Americans, but a new report says doctors aren't paying enough attention to patients with high blood pressure. Researchers at the Institute of Medicine urge the CDC to put a new focus back on treating hypertension. 1 in 3 American adults suffer from high blood pressure. For most, the disease is easy to treat. Cut the amount of salt in food, eat more potassium, get more exercise, and lose 10 pounds. The Institute of Medicine is an independent group chartered by Congress. The general director of the LA Opera, Placido Domingo, will undergo surgery later this week. The star tenor is on a